With the emergence of AI, generative AI, I can see more power of AI being created. AI potentially can be an industry revolution 5.0.
And so AI will become so common that it will be invisible. It'll just be there. It'll be part of our healthy living process.
SwissWeeks is a biannual series of events organized by the Embassy of Switzerland and very good partners based here in Singapore. It's a real pleasure to join hands today with Zühlke, our gracious host, and it's really cool to see such a full house tonight.
Singapore, Switzerland, two small countries, no natural resources to speak of, so we have to focus on the one resource we do have, and this is our people. And what is more important to our people than their health?
I was very optimistic to learn about how public healthcare has such a serious and interested attitude towards the use of AI.
Potentially foundation models for healthcare might be a very interesting avenue to explore.
Healthcare is fundamentally an information business, and most of the people that are practicing healthcare, the biggest thing that they have to deal with is a cognitive overload of information.
The biggest challenge to scale AI is really about the ethical consideration of AI. There are a lot of people always worried about, is my data safe? Is AI going to replace my job? Or is AI going to do anything about my data?
A lot of people will have known that the comment about public healthcare is that we have more pilots than the Air Force in Singapore. Right. And I think naturally so, because we do a lot of experimentation, there's a lot of things that we are trying out. But the problem is that a successful experimentation or POC will take many years to be deployed. There's going to be so much changes, and then you have to refactor for the changes.
The question is whether we could actually leverage on technology to actually train an AI system.
How do you actually use generative AI to actually be able to make sense of the many years and tons of research that we have had to actually accelerate discovery?
We launched the FST program, the first wave of it, in 2020, and the concept is basically that we are taking technologies that have been developed, bringing them into the Singaporean ecosystem, and then developing them further and testing here to provide the Singaporeans the opportunity to access the latest gadgets.
It's a transformation of culture, mindset. So one of the most important things is to get people ready and change the culture for the adaptation of AI.
I do see that in the future, a healthcare model is really more of a consumer model. The outcomes that we want to look at is to be able to live healthy.
Improving not just lifespans, but how long we can live a healthy life. And if we can use AI and machine learning models to have better prediction, better diagnostics, better mobile interventions before things happen.
In the end, AI brings the hospital to our people.